when we perform an anterior approach, the surgery is muscle sparing. We leave all of the ligaments and the muscles intact in the back. So it's a more natural way of putting the hip in. And because of that, people get up and move more freely, and they return to work and recreational activities much earlier. The main difference is that the dislocation rate is at least 10 times lower. If you look at the dislocation rate when you perform the procedure through the back, through a posterior approach, it's approximately 3 to 5% nationally. And if you do it through the front, through an anterior approach, it runs between 0.3 to 0.8%, so it's about 10 times lower. The other reason is that by doing the anterior approach, we don't have to do any precautions after surgery. If you do a posterior approach, for 3 months you have to be very careful not to sit in low chairs or on low toilet seats, not to bend over past 90 degrees at the hip, and not to cross your legs. When we do an anterior approach, there are no hip precautions from day one. We find that the pain that people have after doing an anterior approach compared to a posterior approach is much less. Most people go on pain pills, and they don't need to have morphine or other IV medications. Some go straight to Advil or Tylenol within the first 24 hours. The return to normal activities is very different from person to person. Some people are able to return to work within 2 to 3 weeks, but it depends on the type of job that they do. If they have a very physical job or a job where they have to stand for a long period of time, that can take up to 6 to 8 weeks. If they're performing a desk-type job, they can return usually within 2.5 to 3 weeks. As far as recreational activities, most of the golfers or tennis players can return within 6 to 8 weeks, but there's variation from person to person. When patients come into my office, they often ask, why do we do this? And one of the main things that I tell them is that I've had over 40 patients where I performed a posterior approach on one hip, and then they came back years later to have their second hip done on the opposite side, and we performed the procedure through an anterior approach. Those people all came back to tell us that this was anywhere from 4 to 5 times easier to recover from. So it was a major force and influence in determining that this was the right thing to do for our patients.